Hello, I am Dr. Jennifer Birdsall, a licensed clinical psychologist and the clinical director for CHE Behavioral Health Services. And today I'm going to talk to you about a very important topic, which is how to cope and be resilient during a significant stressor. And for this presentation, we are going to specifically talk about how to cope and be resilient in the face of the COVID-19 pandemic. This is especially important for those of us who are working in the skilled nursing facility industry, because we know that healthcare workers are at an increased risk for emotional distress during this time. And this is a result of all of the unique added challenges we are facing as we work to take care of the most vulnerable population during the COVID-19 outbreak. What is really important is not that we avoid feeling those negative emotions. I don't think there is any one person who works in the skilled nursing home industry, as well as probably most people around the entire globe at this time, who are not experiencing at least some increased stress or worry or fear or some impact of the COVID-19 pandemic. What is important is that you feel you have the coping skills to manage those stressors. That is what is important. They are unavoidable, but if we can cope and we can manage that stress, that is how we are going to maintain our resiliency and be able to successfully work through this time and come out at the end with being okay emotionally, okay physically, and throughout maintaining our best practices, caring for those patients who we do care very deeply about. And so what I want to emphasize is that it is normal to feel these different emotional distress reactions, to feel increased stress. It is a normal response to an abnormal situation. This is the first pandemic that any of us in this lifetime have gone through, and that's a good thing that we don't have many pandemics, worldwide pandemics. But I think it's safe to say for many of us working in the skilled nursing home industry, this may be the most scary and stressful experience we have ever gone through. And so what I want to do today is really take the time to walk you through the key steps of healthy coping so we can build our resiliency to face this time. The first step to doing that is identifying what are the triggers to increase stress. Okay, it is so important because we need to know what are the stressors that could potentially trigger us to feel anxious, to feel worried, to feel negative emotions. Because if we know what those triggers are, then we can be aware of them when they're occurring and plan how to cope with them. So the first step is identifying what are the increased stressors related to the COVID-19 pandemic that we may experience as healthcare workers and SNFs. So obviously, right at the top, of course, is a fear of contracting COVID-19 and getting sick, fear of contracting it and spreading the virus to others, our family members or other loved ones, and of course, fear of unintentionally infecting our patients. This is normal. Anytime there is a virus, a contagious agent, it is normal to fear contracting it and spreading it. So that is absolutely a cause for potential increased stress for all of us. Another thing that may be stressful is potential limited resources. Many of us were low on PPE in our facilities, or we had concerns of running out of PPE. And that could still be a concern for some of us in our particular nursing homes. And so that is a huge cause of distress for a lot of individuals, as well as, worrying about the proper use of PPE and making sure we're doing the right infection control procedures. Do I need to wear just a mask? Do I need to wear gloves or a gown? What is the right protocol? And for many of us, we are kind of switching how we use PPE. Before there was a shortage, we would use things like N95 masks, and then those would be thrown out and we get a new one the next time. But now there's been new protocols around disinfecting certain PPE. So the protocols have changed, and that can be very stressful to try to keep up with it and make sure that we are, using PPE properly and have sufficient supply. I think another trigger or stressor that has been very difficult for a lot of individuals in the healthcare industry is feeling misunderstood by family and friends, or feeling like you have to justify your work. You may have family members saying, well, do you have to go in? Why do you need to do that? Can someone else do that? Maybe you should look for different work. And that can be very challenging because, of course, we care for our families. We don't want to have, discord amongst our family or added stress at home. But I think most of us have a deep sense of responsibility to our jobs, to our colleagues, to our patients, for the passion we feel for this career that we chose to take care of others and to take care specifically of patients who are most at need. So that can be a very difficult thing to navigate. Also, I've heard some of my colleagues say that they felt pretty bad about this sense of a lack of appreciation from the community at large. We have had a lot of support for each other in the nursing home industry. I've seen a lot of really amazing inspirational campaigns and motivational things happening throughout our organizations. But I think when we look at the news, we see a lot of appreciation for the hospital workers, so nurses and doctors who work in the ER or the hospitals. And a lot of people in the community may not understand what we do or the role that we have caring for medically frail and fragile individuals. We have active COVID cases that we are taking care of in our nursing homes. We have facilities who are taking patients from the hospital after testing positive. And so after their acute hospital stay, they're going to a nursing home for their continued care. And we are at the front line still in the nursing home. And so that could be really hard when people don't necessarily appreciate really the amazing work that nursing home staff are doing as well. And then on top of that, we're seeing negative news stories associated with nursing homes. And that can be so challenging because I know as a nursing home worker myself that every single staff member is doing everything they can to keep our patients safe, to prevent infection and spread of COVID. And sometimes, no matter what we do, it still gets into our building. And to see news stories that focus on a big outbreak in a facility or that are interviewing a family member that has some negative comments about how they feel the facility took care of their loved one, that can really be disheartening because, again, I know that we are doing everything we can to protect our patients. And I spoke to one nursing home administrator who said, Dr. Birdsall, it feels like I'm in this war. I feel like I'm at war with COVID, and me and my staff, I am so proud of them. We are doing everything we can to keep our patients safe. And we still had active COVID cases in our building. I'm in Los Angeles. The facilities in Los Angeles is one of the hardest hit cities at this time. And it's very difficult to, protect all of our patients with such a contagious virus. And she said, no matter what we're doing, I feel like we have this enemy that somehow was able to cross our lines. And I think that was a really good analogy, right? And that's very difficult to do everything you can and still have COVID enter your building. But it's even harder if you feel like then there's kind of this negative, misinterpretation by people that maybe you didn't do enough. So that could be really, really difficult to experience. And then, of course, for many of us, there's been a change in workflow and responsibility. We have individuals who are working double shifts or working with new colleagues, different patients that they didn't know before. A lot of buildings have started to have a designated COVID unit. And so it's a whole bunch of different staff that maybe have volunteered or come together to work on that unit. So again, it's a new team, a new unit, new patients, new workflows. So this can be very stressful. Probably the most devastating part of the COVID-19 pandemic is the loss of life. Many of us have had experiences where we've lost patients. Some of us have lost coworkers, and it is really tragic. And that added grief experience can really add to the psychological distress that many of us are experiencing during this time. And it adds to the pressure to keep our patients safe. So there's a lot of pressure we're putting on ourselves. We also are experiencing a lot of fatigue. Many of us are working double shifts or longer hours. Nursing home administrators and leaders are on call 24/7. They are taking calls and texts in the middle of the night if a patient gets a fever, has a symptom, to help triage and stay on top of what's happening in their building and what they need to report. So it is very exhausting. And, we can only begin to imagine how distressed our patients themselves are. That is a whole nother in-service to talk about the impact of COVID on our patients directly. But we know from their, loss of routine, of all of their structured social activities, of not being able to have family visitors and friends, that there is an increase in emotional distress and, unfortunately, more challenging reactions and behaviors that our patients are exhibiting, more attention-seeking behaviors. That makes complete sense. We can understand that and have a lot of empathy for our patients, but it also adds an extra burden and demand on our staff during this time. And what's really challenging is that there's no end in sight, right? COVID will end, this experience will end, but right now it's continuing. I think it's lasting longer than any of us had anticipated, and things are changing daily. So trying to keep on top of all of the different changes for as long as we've been experiencing this, and as long as we will continue to experience the impact of COVID, is pretty significant. And so, what I want to share is that, again, it is normal. It is normal to experience some amount of distress during this time, but what's so important is that we can cope. I do want to take some time to just talk about the psychological risk during this time to put that into perspective. The good news is that most people are resilient and they are going to weather the pandemic storm with no mental health symptoms at the end. Even though we're experiencing it now, we are going to weather the storm and we are going to be okay. However, based on past disaster research, so these are things like man-made disasters, natural disasters, earthquakes, fires, 9/11, we know that healthcare workers, 10 to 20% of them are at risk for a new mental health disorder that they didn't have before the disaster. So we will suspect that we will see a similar number for healthcare workers after the COVID-19 pandemic. We are already seeing from just limited data that's coming out since January, February, that there's already a spike in acute, kind of right now, current emotional distress related to the pandemic. So there's some early studies from healthcare workers or the general population in Wuhan, China, and absolutely people are endorsing symptoms of depression and anxiety, post-traumatic stress disorder-like symptoms, insomnia, which is sleep disturbance. But also in the US, we see some spikes as well. So, looking at data from psychotropic medications, so these are medications for mood issues, we have seen that there was a 21% increase in anti-anxiety, antidepression, and sleep medicines from February 15th to March 15th, with 78% of those being new prescriptions. That doesn't mean all of those individuals developed a new psychological disorder. I'm sure part of it just anecdotally was that, during that time there was social distancing, people were really busy, taking care of everybody who had COVID. Healthcare workers, nursing home workers were working very diligently. And it's hard to find a psychologist, find a therapist, set up an appointment during that time. It's much easier to probably call a primary care physician and get some type of medication. But it certainly suggests that people were experiencing a very intense acute increase in stress at that time. And we also see from a recent Kaiser Family Foundation poll that 56% of respondents reported that they had worry and stress directly because of COVID-19 that led to at least one mental health symptom. So things like trouble eating or trouble sleeping, drinking more alcohol, body symptoms like headaches or stomach aches, feeling they had a shorter temper, they were more irritable, things like that. And 64% of frontline healthcare workers and their families reported worsening mental health since the COVID-19 outbreak. We're also seeing a lot more calls to the crisis hotlines. This is across the board, but to give you an example, the Sacramento crisis line, their calls increased 40% from February to calls in March. And when they did a year-to-year comparison in April, there was 58% greater call volume this April compared to last April. So again, this is really showing us that the COVID-19 pandemic is absolutely causing people to experience emotional distress. We also know from past disaster research that individuals who have a previous mental health diagnosis, like depression, anxiety diagnosis, post-traumatic stress disorder, they are at an increased risk for those symptoms to increase or to relapse because of a disaster. And I think, again, COVID is one of the most stressful situations that most of us have been through during this lifetime. So if you have a past mental health disorder, it is more important than ever to really consider your coping skills so you can manage the added stress during this time. For some people, they may not experience symptoms till after the acute crisis stage of the pandemic has passed. Many of us are on the go. We're just in survival mode. We're very busy. We're taking care of patients. We're working really hard. We're working long hours. We don't even have time to think about what we're experiencing. Our adrenaline's up. But once that period ends and we settle down, that's sometimes where we can see those symptoms start to creep in. So we really want to watch, even if I'm talking about certain symptoms and experiences and it doesn't seem like this is what you're experiencing at this time, we still want to think about healthy coping and monitor our symptoms and our mood for a while after the COVID pandemic. And the good news is that symptoms do lessen over time. So for those of us who do, develop maybe a more significant diagnosis, we actually feel that we have depression or some significant anxiety diagnosis, those symptoms do lessen over time. But if we don't cope well in the moment, they can continue on even for many years. So while the severity lessens, people sometimes do report ongoing depression or anxiety years out after a disaster. And this is certainly true when we look at the SARS epidemic from 2003. Individuals who had severe symptoms during the epidemic, during the outbreak, even 5 years later, they continued to report some depression symptoms, some anxiety symptoms, although they were much less. And finally, here I am talking about kind of more extreme mental health symptoms. For most of us, as I said, we are going to be just fine. We're resilient. It's all about healthy coping. But even if we don't see those kind of more significant symptoms or diagnoses, many of us may experience some increased family discord at home, stress at home. We might experience some more difficulties at work or with our colleagues or how we're concentrating. And some people might find that they're using substances to cope. So some unhealthy coping skills that can be making things challenging for them at this time. And so that's important to consider as well. Even if it's something less severe, we want to monitor how we're coping so that we can take care of ourselves to the best ability. So how do we do this? How do we cope and be resilient during the pandemic? Well, the first thing, as I said, is know your stressors. Know what you are experiencing or could potentially experience that would trigger you to feel more stress. Because if you're aware of that, you can pay attention, acknowledge when they happen, and consciously choose to cope. So we want to know what those stressors are. And part of that is knowing, how do we know we're stressed? What's our own personal indicator to us to clue us in that we are under duress or feeling distressed at that time? We're going to talk about that in a minute. Then we want to consider our coping strategies. What works for you? What has already worked for you? We want to, as best we can, stay adaptable and flexible. We want to tap into social support, which we're going to have to be creative to do during the pandemic and social distancing. We want to work really hard to stay positive, to have healthy thinking, positive attitudes. That can be very difficult to do with what we're faced with every day during the pandemic, but that is a huge part to resiliency. We want to do our best to engage in healthy behaviors such as healthy sleep, eating, and exercise. And we want to practice relaxation, because relaxation and doing very conscious activities to help us relax has been shown to really successfully help manage stress. So we're going to go through all of these today. Okay. So as I said, we have to know when we're stressed. That's number one. And so here I've been using this term stress a lot already throughout this presentation, but what exactly is stress? What do I mean by that? Well, stress is physical, mental, or emotional strain or tension. And for most people, they feel stress either because of something physical happening to their body, that's how they experience stress, something emotional, something cognitive, that's just another way for thinking, there's a change in their thinking, or there's a change in their behavior in some way. So these are indicators, or another word for indicator is clue or cue. So your cue that you're feeling stress at that time. So some examples of physical indicators of stress are muscle tension, squeezing our muscles, just feeling very fatigued, very tired, sometimes upset stomach, other body symptoms, tension, headaches, things like that. Emotional indicators are feeling anxious, worrying a lot, feeling like you can't control your worry, maybe being more irritable, snapping at people more easily, or certainly feeling sad or depressed. Thinking changes, if you're stressed in terms of thinking, you might find that you have a lot of negative thinking. So we're going to talk about thinking quite a bit in this presentation later on. Or it might be that you just feel foggy, you can't think as clearly, your thinking speed is slowed down, or you're having difficulty focusing, concentrating, paying attention, or even difficulties making decisions. And then behavioral indicators are maybe you're just more impulsive because you're not thinking things through. Or again, you're snapping at others. That's a clue that you might be more irritable or on edge. Maybe you withdraw, you just, stop talking to people. Maybe you talk a lot and now you notice you're not engaging or having conversations, or you're not, enjoying or participating in activities that you used to enjoy. Or maybe you are using more substances, as I said earlier, or some other unhealthy coping skill that actually can cause some, pretty significant issues for you if that's happening. Okay, so let's take charge of stress. Let's build resiliency. Good stress management helps you be resilient and hold up under pressure. And we know that there is a lot of pressure because of COVID-19. What I want to say as we start to go through these next slides, because we're going to get right into it and start talking about some healthy coping skills, is that stress management is not a one-size-fits-all. What's really important is that you identify what works for you. That's what's important, what works for you, because when we are stressed, that's kind of the thinking indicator. One of the impacts of stress is not thinking as clearly. We may feel foggy, we may feel worn down. We're not at our best in terms of thinking and coping. So if you do this ahead of time, if you work with me today as we go through this presentation and really think about what works for you, what are your coping skills, so you can have that in place, kind of like a plan, right? We're doing that now. We're going to plan how we're going to respond when those inevitable stressors occur. That's going to help you stay on top of this. And what I encourage you to do is write these things down. If you have access to a pen and paper while you're watching this, write down coping skills that you think would work for you. So in the time of stress or when you're emotionally charged, all you have to do is look at that cheat sheet, your menu, your coping skill menu that's specific to you and what might work for you. Okay, so the first thing to consider and start writing these down is what coping skills do you already use, right? When this is a pretty big stressor, but even for small stressors, if you're in a bad mood, if you had a bad day, if you're feeling a little anxious, what do you use that works for you? Do you listen to music? Do you like to walk? Do you like to read? Do you like cooking, baking, cleaning, organizing? That might sound odd, cleaning, but for some people that does make them feel better, and that is a way for them to take their mind off things. Having a cup of tea, exercising, yoga. What do you do and what works for you? And write those down, your person-centered care coping skills. Some other things to just be aware of specific to COVID. The first thing I want to recommend, and this has been recommended by a lot of experts, is to limit your media consumption. We are so used to being glued to our phones, glued to the TV in the nursing home. The news is on, TVs are on all day, and this has been shown to actually increase anxiety and stress in individuals. This does not mean be uninformed. We absolutely have to be informed, and we need to know what's going on in our communities, what's going on with COVID, what's happening around the world, what's happening with testing. But what this means is significantly limiting your consumption and making it a conscious choice of when and how much to engage in the news. Okay, so it's very, very important. Frequently remind yourself of the positive work you're doing. I know it can be challenging. As I said earlier, when we were going through the trigger slides for COVID and the impact. It can be hard when friends and family members don't understand, or they're asking you to maybe not go to work, or they don't understand why you're going to work, or you're seeing news coverage about nursing facilities that's negative. It is so important to remind yourself of what you're doing. You are absolutely a healthcare hero. You are essential. These are the most vulnerable patients and they need care, okay? And you are doing an amazing thing. And it's important to remind yourself of that. Say what you are grateful for every day. And I'm not going to say much about this here because this is actually a really important part of stress management and resiliency, gratitude, and I'm going to spend some time talking about this later, but that is something I want everyone to do during the COVID-19 pandemic is their gratitude list. Take more breaks. It is okay to take a break. You are not shirking your responsibilities. You are not going to let a patient down or a colleague down by taking a break. In fact, it's just the opposite. We know as caregivers that in order to take good care of our patients, we have to care for ourselves. This is a truly stressful time, and you need to take breaks for yourself. And if you can, spend time outdoors. This has been really challenging with the pandemic. We are working long hours and then we go straight home. And we're avoiding stores, grocery stores. We can't go into other stores. Our activities are not available to us. Restaurants are not available to us that are outside of our home. So many of us are just going from work to home. And that, because of how long the COVID-19 pandemic is lasting and social distancing is lasting, that can start to weigh on us. We need a change in environment. That's good for our mental health to have that change in environment. So take a walk, go outside, of course, wear your mask, use the appropriate PPE, but spend some time outdoors if you can. And there are some really great resources coming out specific to COVID on healthy coping. And so one resource that I have downloaded myself, and I think it's wonderful, is the COVID Coach app that was developed by the U.S. Department of Veteran Affairs. It's free. And this app provides a lot of education around the COVID pandemic, so great information. But what I'm really impressed with and why I'm putting it on today's presentation is because there are a number of tools that can help you with good self-care and to help your emotional well-being. Things, different interventions to help you cope with stress. Relaxation activities, I'm going to talk about those. There's examples here. If you're struggling with sleep, different information and activities to help you sleep better. So I really encourage you to download this and use this as needed. So let's start discussing some of the different coping strategies we can do to help us better cope with stress and stay resilient during the COVID-19 pandemic. And the first thing I want everyone to try to do, which is harder than it sounds, is to accept the things that you cannot change. Do not try to control the uncontrollable. There are so many times we spend quite a bit of energy, mental energy, physical energy, on things we do not have control over. And during the COVID-19 pandemic, there are so many things that are going to require our skills, problem solving, thinking, energy, time, that it does not help us to spend all of this energy on things we can't control. It is much better stress management to shift all of that energy into things we do have control over. So for example, we may be struggling with helping our patients at times. It's a very difficult situation for them. We can't control that there's no longer group structured activities at this time, or that family members can't come. We can't control that. But we can control a number of things we do to help support our residents and offer different individual activities. So we're going to shift our energies to what we have control over. And we also want to work really hard on being flexible. Stressful situations absolutely require us to be adaptable, and the COVID-19 pandemic is no exception. We know that on a daily basis, it feels like things are changing, and we have to be adaptable and flow with those changes. What are the new testing requirements? What do we have to report? Do we have to switch staff to different units, move patients around? These are things that are going to happen. And we know from research that individuals who are flexible, they not only cope better with stress, but they actually experience less negative affect during the stressor and afterwards. So we want to do our best to be flexible and adaptable. Social support. It is so important that we connect with other people. Research has shown consistently that social support is one of the most effective coping skills to help deal with stress. And connecting with people doesn't mean that they have to solve your problems. That's not what I mean by social support, right? That you talk to someone and they solve your problem. It's just being connected, being with others. It is huge. This is challenging during COVID, right? We have social distancing, quarantine requirements, stay-at-home orders in certain cities. So we are going to have to be creative in thinking how we're going to socially connect with other people. But there are lots of ways to do this, right? Luckily, there are so many new softwares and apps, Zoom, Skype, FaceTime, Google Meets. There's so many ways to connect with people virtually, groups, not even just individuals. We can do groups at a time, but reach out to a colleague at work. Check in with loved one and ask them to check in with you. You know, once a day, text each other, call, email a friend. God forbid we write a letter and send snail mail. I have to tell you, I had a friend who sent a postcard to all of us in our circle of friends, and it was so amazing to get that postcard in the mail and have her check in on me. It was really wonderful. You can confide in faith leaders. So even if you are unable to attend a service, you absolutely are able to, call or speak to faith leaders. So think about ways that you can connect with others. Okay, develop healthy thinking. This is really important. Let's spend some time on healthy thinking. What I want everyone to do during this pandemic is really start to pay attention to what you're thinking. Pay attention to what you're telling yourself. We don't typically do this throughout the day. We have thoughts constantly. We are constantly thinking, but we rarely ever think about our thoughts. And unfortunately, many of our thoughts are not nice thoughts. They're not helpful, they're not realistic, and they're not accurate. And so one thing I want to share, and I want everyone to just be aware of this when they finish this in service, is that thoughts are not facts. Just because we think something doesn't make it true. And unfortunately, when we're in a stressful situation, a lot of times we find that we are having more negative thoughts, more unhelpful thoughts. These are things like catastrophizing, thinking the worst is going to happen, assuming the worst is going to happen, or overgeneralizing, taking one example of something that happened and thinking that it's going to happen all of the time. Right. So if we have, one patient pass away, thinking that all of our patients are going to pass away, really overgeneralize, which can be very dangerous. Or just in general, having a negative filter. And a negative filter is where we really just focus on the negatives. And really, in any given day, for all of us, there are good things that happen, and there are not so great things that happen. And so if we're having a negative filter, we are just disregarding. We're not even thinking about all the positives. We're only focusing on the negatives, and that can make us feel pretty bad, as you can imagine. Okay. So what are some examples of, a negative automatic thought related to COVID? Well, for example, everyone is going to get sick. It's going to overwhelm my work. I won't be able to bear the burden. I can't do this on my own. I'm going to be left all alone. Or I know I'm going to get sick, even though I'm using all of the PPE precautions and safety precautions. Or a patient was hospitalized and placed on a ventilator because I didn't do enough. If that patient dies, it's going to be my fault. And others. You can imagine that these are not helpful. These are really harmful thoughts. And we tend to have thoughts like this that go through our mind all the time. So during a stressful situation. And so we really have to step back and challenge those thoughts. Be aware of those thoughts. So how do we do that? Well, we first have to be aware that we're having them. So identify what the thought is, and then start to challenge them. So you can do things like ask, is this thought helpful? Is there another way of looking at this situation? Is this thought a fact, or is it my opinion, or just an automatic thought that went through my brain? What is the evidence that this is true? Or what advice would I give someone else? How would someone else see this? If my friend came to me, or my colleague came to me and said that thought, what would I say to them, right? That is ridiculous. That is not true. How could you say that to yourself? Right? So we want to start challenging those thoughts. In addition, a healthy way to shift our thinking is to really proactively engage in more positive self-talk. Say kind things to yourself. Be more positive. This does not mean self-deception. We're not going to lie to ourselves. We won't believe it, right? So what we say when we talk about positive self-talk, it still has to be true, but to be more positive and more realistic. So again, it's okay to feel anxious, right? If someone tells me they didn't have an ounce of anxiety through this pandemic, I'm not sure I'm going to believe them. That just seems really not true. How could anyone in healthcare working in the nursing homes not have experienced anxiety, right? So it's okay to experience anxiety, but say to yourself, I can cope with my anxiety. You can cope with your anxiety, right? And so that's positive self-talk. I'm feeling anxious, but I can cope with it. I can problem solve. I can prepare for the upcoming events. I know ways to cope with stress. I'm going to get through this. And if you have a hard time making those statements, at a minimum, change those self-limiting statements that like you're limiting yourself by saying, I can't, right? To questions to get you starting to think about healthy coping. So instead of saying, I can't do this, or if you catch yourself saying, I can't do this, then ask yourself, how can I do this? Or this is impossible. To ask yourself, well, how can I make this possible? How is this possible? Okay. The other thing we want to work towards is positive emotions. Okay, we want to be positive as much as possible. Again, that doesn't mean not being real, not experiencing the distress that we might experience, but really working towards bringing in more optimism and more gratitude into every single day. When we are going through something like the pandemic, where we are hit with stressors every single day, that's where we can start to get that negative filter. So we have to consciously work to start bringing that optimism back to our day. And this is really important because research has shown that people who do gratitude exercises, who are more optimistic, again, they cope better with stress and they ultimately have less negative affect. And at first, this may feel a little forced to do this. If you're not used to doing a gratitude list or kind of focusing on positive, it may feel a little forced, but like anything, it becomes a habit and it becomes part of your daily thinking after time, after practicing it. And I can tell you that this is something I do every single day. When I wake up in the morning, every single morning, I think about what I am grateful for. I think about my gratitude list. And so gratitude is just an awareness of the good things that are happening in your life and what you're thankful for. Okay, what are you thankful for? And again, studies have shown that people who do weekly or daily, but I'm going to say daily in the case of the COVID-19 pandemic, daily gratitude exercises, they have higher levels of positive affect, which is positive mood and emotions, even during stressful situations. So how do you do this? Well, here you heard me say that I do just a mental list. And that is certainly something you can do, a daily gratitude list just in your mind. But for those of you who have not done this previously, I actually recommend going one step further during your practice and either keeping a gratitude journal where you have a journal and you actually write down things you're grateful for, or if you don't want to have a journal, still writing 3 things down every day. You don't have to keep the paper, it can be on any scrap paper, but writing 3 things down every single day that you are grateful for. And this doesn't have to be some grand thing that happened. It could be someone made you laugh, you got a text from a friend that made you feel better and you appreciated, you finally got to watch some TV tonight and saw a great episode of your favorite show. It can be anything, but 3 things that you are grateful for every single day. And finally, another great way to practice gratitude is to thank somebody else. So you are actually grateful, but now you're proactively thanking that other person. And that feels great because now you know that you brought some light to someone else's day. And when we make someone else feel good, that just kind of pays it forward one more time, right? It's kind of a double impact because it makes us feel good to make somebody else feel good. So practicing gratitude is huge. And the last thing I want to say about kind of our thinking is to talk a little bit about worrying. I know a lot of people are doing quite a bit of worrying during the pandemic. It's hard not to. Will I get sick? When will this end? Will I bring the virus home to my family? Are we going to get COVID in our building? What if a patient dies? And on it goes. Just the what if and ... fill in the blank for you. What I want to say about worrying is that while it's hard not to do during this stressful time, worrying isn't helpful, right? So ruminating and worrying, that's not the same as planning. It doesn't get us anywhere. It's like a hamster spinning on a wheel. Worrying doesn't help. And so for those of you who feel like you're worrying a lot, what I recommend you do is schedule a worry time, right? And set a timer. You get 10 minutes. 10 minutes a day is plenty of time to just go through worries and to ruminate and lay it all out there on the table for that day. After 10 minutes, it's really going to start being counterproductive to your emotional health and focusing your energies, right? We talked about our energies, focusing on what we can control and using our energies in that way. So after the 10 minutes, if there are certain things that you're particularly concerned about that you feel you need to plan for and now shift to planning and coping, that's what you can do. If this happens, right, then what can I do about it? And if this happens, should be something that could realistically happen, not something we're catastrophizing about that is very unlikely to happen. Okay, so 10 minutes of worry time, and that's it. Okay, so also when we think about stress management, it's really important to think about our health habits. Again, I want to acknowledge that these seem simple enough, but we all know it's actually quite hard during the pandemic when we're working double shifts all the time. Crises are happening, patients are getting sick, we're dealing with so many things changing daily, that it is hard to focus on healthy eating, getting enough sleep, and exercises. I get that, okay? I completely get that. However, I still want to emphasize when it comes to stress management that all three of these things will help you cope better with all of those things you're facing during the pandemic. We know that sleep helps with stress management. That makes absolute sense, right? If you sleep, if your mind is rested, if your body is rested, you're going to be that much in better shape to take on whatever challenges you're facing the next day. The same is true for healthy eating. Our body needs energy, it needs nutrients, it needs vitamins. Eating foods that have good calories, good nutrients are going to help us deal with stress better. And the same is true for exercise. Exercise has been shown to be one of the top coping skills to manage stress, and that's for a lot of reasons, actually. Regular exercise helps us sleep better. We go to sleep quicker, we have deeper, better sleep, but also, exercise can help us actually shake off some of the physiological impacts of stress, like cortisol and adrenaline and things that go on in our body, and it keeps our body healthy. And when I say exercise, I don't mean that you have to start CrossFit or start going to a gym, which we can't do anyway during COVID. It can be just thinking about moments throughout your day where you can be a little bit physical and active that maybe you weren't doing before. So for example, even if you're tired when you get home, if you have a dog, instead of just letting the dog run out in the backyard, go ahead and take a walk around the block, 5 or 10 minute walk. It doesn't have to be miles, but it gets your body moving, gets you flowing. So start to be creative and think about ways you might be able to move your body a little bit more. And that can be something that really does help you with stress. And finally, we really want to talk about how you can make time for rest and relaxation. If you regularly make time for rest and relaxation, you are going to be better able to handle life stressors and COVID stressors, okay? I recognize you may need to be creative during the pandemic. Things you used to do to relax, like lay out at the beach, or go have a cup of coffee with a friend, or go to Starbucks and read. You may not be able to do that now, but there are other things we can absolutely do to help us rest and have relaxation. So one, set aside time for rest, and this includes breaks. I already talked about breaks. You need to have breaks to recharge your batteries. So purposefully plan and take those breaks. And then also identify activities that help you feel more relaxed, like having a cup of tea, taking a bath, lighting a candle, and certainly even practicing formal relaxation exercises, which I'll talk about in a moment. So why is this important? Why am I spending time on relaxation? Well, I want to take a moment to actually explain what happens in the brain when we are stressed, and at times we might flip our lid. What do I mean by flip our lid? Well, Dr. Daniel Siegel, he has a great handy model of the brain. So here's an image here, but if you can see me on the screen, I'm gonna walk you through it. So if you think about your hand being the brain, so down here, you know, our wrist is kind of our spinal cord that leads up to our brain stem right here. Kind of this is where, you know, it controls our breathing and our heart rate and everything we kind of have in common with a lizard, right? And then if you take your thumb and just turn your thumb in right here, that is going to represent our emotional center, or what we call our limbic region, okay, our emotions. And if we kind of curl our fingers over the emotional center, that is our cerebral cortex. That is our higher level part of the brain. And right here, the middle fingers represent right here our prefrontal cortex, kind of right in your forehead. And that is, you know, your higher level thinking. That is your problem solving. That is your reasoning. That is your judgment, right? That allows you to inhibit things so you're not impulsive. And so that kind of goes over our emotions, so that although we have emotions and our emotions are important, they give us a lot of useful information about how we're feeling, we're still able to reason and act in ways that are healthy and make conscious decisions on how to cope. But when we are faced with a lot of stress and something triggers us, right, what can happen is we might flip our lid. Okay, and so all of those reasoning and higher level thinking, you know, areas of our brain, they flip up, and then we are left with our emotions. And when we're very emotional, we don't always make great decisions. We don't always think about how to tap into our coping skills, how to calm ourselves, how to regulate our emotions. And that's where we can feel pretty bad and extreme distress, maybe not do so well at work, maybe we snap at a colleague or raise our voice or get frustrated with a patient, just generally feel bad, right? And so when we do, when we can step away, right, when we can acknowledge, if we know, we can identify, whoop, our you know, lid just flipped up, we flipped our lid. If we can step back and do something that could help us relax, right? Help us kind of take down that emotional thermometer just a little bit, then we can re-engage, we can flip back our higher level functioning so we can cope better. And I bring this up because during the COVID pandemic, we have the potential to experience a lot of triggering events that might flip our lid. And when I think about resilience and coping, I want to help everyone be able to keep those frontal lobes down so you can tap into those coping skills and manage that stress better. The stress is going to be there. It does not take the stressor away, right? If people call off, they've called off, right? If we have extra work, we have extra work. Unfortunately, if a patient tests positive or coworkers test positive, they've tested positive. We just need to be able to cope with those things. And that's where I want to get you guys to. So what is relaxation? Well, relaxation is refreshing your mind and body. And when we relax, it means we feel less tense. We've been able to release the effects of stress or release ourselves from worry. And if we practice relaxation, if we do successful relaxation, what we're going to see is that we can reduce our anxiety, anger, irritability, any negative affect. Relaxation helps us prevent stress from building up, which is huge in COVID, where there's so many potential stressors on a daily basis. Doing relaxation exercises can help decrease our muscle tension or help us reduce headaches or any physical issues related to stress. It helps us think better. When we're more relaxed, we can concentrate better. Our thinking is better. So that's going to help us face problems and problem solve better. And absolutely, it helps us sleep, right? And so here, as I said, we want to really use relaxation when we're stressed to get that emotional thermometer down so that we are in a more comfortable level where we can effectively cope. Because of time, I just don't have, there's so much information I'm giving you today. I don't have the time that I want to actually go through relaxation exercises. There are a number of formal relaxation techniques that have been shown to work to literally not only help us relax, kind of feel relaxed emotionally, but we can tell even in our body, our heart rate slows, right? Our breathing gets deeper and less breath. So we really can kind of de-escalate and get our body and mind in a much more relaxed state. And these are things like guided breathing, progressive muscle relaxation, guided imagery, mindfulness meditations. There's so many good relaxation exercises out there. And you can find those to practice all over the internet. You can Google and you will find, examples and scripts there's videos you can YouTube, there's apps, there's an app for that. There's apps on mindfulness meditations, on sleeping, relaxation to help you sleep, and on it goes. But I have personally recorded a video, which if you can either just type this into your browser, this link, or if you have the PDF, you can click on it and just open it up. This is a public video where I walk you through 3 different types of relaxation exercises, deep breathing, progressive muscle relaxation, and guided imagery, and teach you how to do those. And so I really encourage everybody watching this video, especially during a time like the COVID-19 pandemic where stress is very, very high, that you actually take time to learn and practice relaxation exercises. And as I said earlier, one size does not fit all. So you may find that you really like one of these more than the others. That's great. Then just use that one, but take some time to practice. What I would like to do is show you 2 very brief relaxation exercises. The reason I want to show these 2 to you today is because I know when we are working at the nursing home, our days are very busy. We have a lot to do, and these can happen in less than a minute. You can do these in less than a minute. So these are great because you literally can do either one of these as you're walking from one patient's room to the next. So the first one is a very simple visualization where you imagine inhaling pure, cleansing, healing air on the inhale, and then as you exhale, you imagine any stress, tension, anxiety, worry exiting your body. So just leave you in a much better state of calm. Okay, so let's do that together. Let's practice. So again, inhale, pure, healing air, and then as you exhale, imagine all of that tension and negativity leaving your body. Okay, so inhale, goodness and strength, and exhale any tension, worry, anxiety, etc. Okay, so those can be very healing breaths where you just visualize that effect on your body. And another one is where you can imagine, where you hold your fist and imagine any stress, tension, worries from your mind, worries from your heart, physical sensations, just imagine it all moving, pooling into your fist, and you're holding it there, and then open up your palm and let it go. And just imagine all of that leaving your body. Okay, so those are things that they do work. And again, they don't eliminate the stressor, but they can take that emotional thermometer down to where you're in a much more comfortable state and can continue on with your day. Well, as we get toward the end of this presentation, I hope that each of you has identified some new coping skills that can help you better manage stress and stay resilient during the COVID-19 pandemic. The last thing I want to briefly talk about today is when should I seek help? When might it be a time where I find that working with a professional, a therapist, a counselor can really help me better cope throughout the COVID-19 pandemic and manage whatever stressors or symptoms I might be experiencing? And a big indicator to where you might feel that extra help is needed is when those symptoms or stressors is impacting your functioning in a negative way, where you feel your coping skills are not enough to manage the stress you're experiencing at home or in your relationships, or you feel that those different symptoms are really starting to negatively impact your functioning at work. That is a really big clue where you may benefit from having someone to help you work through this difficult time. And certainly if you feel that the symptoms you're experiencing of anxiety or depression or trauma-like symptoms are pretty significant and you would like extra help to really ensure you can work through them successfully and come out in a healthier state of mind. And so just keeping an eye on if you're feeling persistent worry or feeling overwhelmed, you're amped up and can't settle yourself down, lots of restlessness and irritability, just excessive worry, you can't stop the worry like we talked about earlier on, or this just general sense that something bad is going to happen that you can't shake and it's starting to impact your sleep and your concentration. In terms of depression, if you're feeling sad or depressed more days than not, and you feel that you just can't do the things you used to do, you're lacking motivation or interest in enjoying things, you're no longer getting pleasure out of your activities, if you have significant changes in your sleep or appetite or weight, certainly if you're feeling worthless and helpless or hopeless or having excessive guilt that you cannot overcome, and absolutely if you're having thoughts of harming yourself or killing yourself. Those are all indicators that you may benefit from seeking out more professional support. So where do you get that help? There are lots of locations and resources that you can access to tap into to seek out a psychologist or counselor or marriage and family therapist. There's a number of good locators online, provider locators like Psychology Today has Find a Therapist, Find a Psychiatrist. There's also a locator from the American Psychological Association or the National Register of Health Psychologists. And you can do some advanced searches here where you can not only say where you live, but what gender you prefer in a provider, what diagnoses you want them to be experts in, even what treatment modality. Certainly you can ask your primary care physician or a faith leader for a referral. You can go onto your insurance website. Most of them have a find a provider option, and you can select behavioral health provider. And you know, in the face of COVID, a lot of us are wanting to do remote therapy. We want to make sure we maintain our social distancing, and there also are resources for that, including my organization, which is CHE Behavioral Health Services. We provide outpatient telehealth services. It's all licensed psychologists providing traditional psychotherapy, but it's virtual, it's with video conferencing, and you can go to www.cheservices.com and see if we provide telehealth in your state and if we have your insurance, and of course there's a private pay option as well. So there are a lot of resources out there, and I really encourage anyone who feels that they need or just want more formal support to reach out and access that. That is what the behavioral health specialist is trained to do. That is their expertise to help you cope and guide you through difficult times. And of course, at any point, if you are feeling like you are in crisis or need services right away, you can always call 911. You can go to your nearest emergency room or use one of the number of amazing crisis lines that we have available to us, such as the National Suicide Prevention Lifeline. So that takes us to the end of my presentation, and I want to end by saying thank you. This is, as I said earlier, one of the most scary and difficult situations all of us in the nursing home industry have ever experienced as we try to take care of the most vulnerable population during the pandemic. And I want each of you to recognize that you are absolutely an essential provider and you are a healthcare hero. And I thank you for all the amazing work that you're doing from the bottom of my heart.